Welcome to ECCMID and welcome to our little studio here again. And let's welcome Professor Maria Souli, if I pronounce that correctly.
Perfect.
So you could recognize your name. You are from the University of Athens, Greece, and you are an associate professor in infectious diseases.
Right,
Is that correct?
Correct, yes.
You reviewed the year in infectious diseases, so you have a deep insight into, well, at least the most important papers. What happened in infectious diseases last year?
So my review focused on papers that would change clinical practice, so it was clinically oriented. And I was very surprised to see, for example, 2 papers on a very important topic of corticosteroids in septic shock. Septic shock can have a mortality of like up to 50%. And one of these papers showed that if we use corticosteroids, we can actually reduce mortality significantly, which is very important for these patients. The other review showed the opposite, but there were some differences in there showing that people in high risk of death would benefit. So
Yes.
this is very important.
I just wanted to step in there because, to my understanding, this has always been pretty controversial, this discussion about corticosteroids in sepsis
It
patients.
still is. As I said, 2 papers showing exactly the opposite conclusion, but there are differences in these papers, and we can use this difference to try to
stratify
exactly the patients with high risk who would benefit most.
So who would benefit most then, if you could put this in a
Those that
nutshell?
have very high risk of death.
Yeah.
So we don't have yet the tool to say, for example, to calculate the risk of death for the patient, but it will come up, I guess, through research.
Is it driven by the causes of the pathogen as well?
Not
Has there been
really,
any
because
studies?
the pathogen was not really into this algorithm.
Yeah.
So it was mostly the severity of illness score, death, mortality in septic shock patients has to do also with the population or other interventions we have to apply for these patients. But overall, it comes between 30 to 50%. So if you can use these metrics and your patient falls into the high-risk category, then you should apply corticosteroids.
Anything else that caught your attention?
Well, we had a long-awaited trial on XDR gram-negative bacteria, comparing monotherapy with colistin and double combination therapy colistin with meropenem. We didn't have any such a trial, and we were waiting for that. So this trial showed that for a specific group of bacteria this time, Acinetobacter, this combination doesn't offer any benefit, so we shouldn't apply that. Although colistin as monotherapy, it's not effective. So the conclusion is we need better drugs. But between the combination and the monotherapy, there is no benefit from the combination, unfortunately.
So this holds true for Acinetobacter, especially
Acinetobacter,
Baumannii.
exactly, Acinetobacter baumannii, because this was the main pathogen of the study.
Yeah.
So we cannot take that conclusion to other pathogens.
Yeah. Okay.
We need more studies.
That's what a boss of mine told me years ago. Just try to read a study, and the last sentence, I tell you what it will say. It will say, we need another study.
Yes.
But that's how it is.
Yes, you answer one question and you have at least 2 more questions to go.
Okay, it's like we're still confused, but on a higher level. Now, you have been to ECCMID for a couple of years now. Is there anything special about this 28th ECCMID here in Madrid?
Well,
to you?
Yes. I've seen ECCMID growing and attracting people from all over the world. So it's not a European conference anymore. It's a global conference, and people from all over the world, come here to learn and to find what is coming up for the next year or so. So it's actually a global, international congress. It's not European.
It's not European anymore.
It's not European.
Which, in this way, is a
It's
very good development.
It is, really.
Thank you very much,
Thank
Professor
you.
Souli, for being here.
Thank you so much.
All the best for you, and see you probably in Amsterdam.
Thank you. Oh, yes, I will. Okay,
Thank you.
Thank you.